My name is Tammy Skrapinski, and I'm from Manitowoc, Wisconsin. I'm serving at Southfield Townhomes, which is a income-based housing complex. It houses 100 families and over 450 residents. And we're tackling self-monitoring blood pressure, food insecurity, and tobacco and vaping. There is a huge need in my community for food security, and we've noticed a lot of youth tobacco use and vaping use, so that's something we hope to really manage and address.
So my name is Emily Sesser. I'm from South Webster, Ohio, which is a very small town in southern Ohio, and I'm serving in Portsmouth, Ohio at Shawnee Family Health Center. One of the things I'm most excited about, Portsmouth specifically, is we're in the middle of an opioid epidemic. It's a very bad problem. We have multiple, like in the hundreds, drug overdoses a year. And so we actually have a program called Project Dawn that started in Portsmouth, where we give out Narcan to community members, and we teach them hands-only CPR whenever we give them the Narcan. So that way they are able to help their family members whenever things happen. To me personally, my cousin overdosed. He was able to live. They were able to save him. But if anybody in our family or that around him had access to Narcan, it would have been a much better situation for him. And so we want to be able to help other people be able to save their friends and family when things like that happen. So I'm really looking forward to being able to do that.
My name is Celia McDowell. I'm from Paducah, Kentucky, and I'm serving at the Oscar Cross Boys and Girls Club, also in Paducah, Kentucky. So a lot of the work I'm doing is in the schools. It involves middle school and high school mostly. I do a lot of work after school with the program at the Boys and Girls Club. I'm focused mostly on the hands-only CPR and teaching the kids at the club and the kids at the middle school how to do hands-only CPR, so then they can go home and teach their parents how to do that, and then if they see someone in public they can also use that. But I also go into nursing homes and I teach them about hypertension. So HeartCorps for me is not only a learning experience for myself, but I'm also getting to educate the members of my community, and that's just truly such a passion of mine, to continue to learn but also educate those around me.
So I'm Basil Heinzman. I'm from Newberry, Indiana, which is a small town in Indiana. I'm serving in Ames, Iowa with Story County Public Health and the Mary Greeley Medical Center. So I'm working with the Department of Public Health, like Story County Public Health, to do work with nutrition security, so not just access to food, but access to healthy food. And then also to do work with expanding their self-monitoring blood pressure program, because actually in Story County there's no place to get your blood pressure taken for free outside of the medical setting other than at specifically Story County Health, and a lot of people don't know about that. And so a lot of people who have hypertension don't have any way to accurately monitor their numbers. So when their doctor says like, hey, pay attention to your numbers, they don't have the resources to do that. So I'm trying to work to improve the conditions for people who have high blood pressure, being able to monitor that. And then also, Eastern Story County is a bit of a food desert. There's not a lot of grocery stores out there, and even the grocery stores that are there don't always sell fresh produce. And so I worked with food pantries, and I've been gathering data on like, so what do you think are the biggest barriers in Story County to people having access to nutritious food? And it's the lack of grocery stores, but it's also that for a lot of people, when they go to the food pantries, they don't really either have access to the equipment to cook, meaning like they don't have access to a working stove, or they don't have access to cooking equipment, or they don't know how to use like the fresh produce